Listen, folks, when it comes to insurance plans, there are many, and you'll want to make the right choice. So here with us this morning from Univera, we've got some ladies who can really help you. Asia Burrows is a Community Engagement Program Manager, and Joanne Flagg is a Marketplace Facilitated Enroller. And that means these ladies talk to people like you out there to answer all your questions about what is involved when you can work with Univera. So good morning, ladies.
Good
morning.
To have you
here.
Thank you for having us. It's a pleasure.
You are the ladies in the know, because people will come to you and say, I don't even know if I'm ready to start to pick, an insurance. So let's start that as a first question. Who comes to you and says, I think it's time for me to pick a healthcare plan?
There are many different types of individuals that will approach us, but quite typically we'll see people who are becoming unemployed, retiring, maybe had a qualifying event, which we'll have an opportunity to discuss, a birth of a baby, and they will come to see, number one, can I afford this? And usually they're very surprised at how affordable the health insurance is.
Right.
Absolutely.
And it can be people who are, their job may be ending, but they're not of retirement age yet.
Exactly
So
right.
they need to fill the gap in.
Fill that
Absolutely.
gap.
Right.
And even couples where, let's say, one of the spouse who was actually carrying the primary coverage, they're retiring, and now that other spouse needs health care. That's a situation where we may be able to help them, actually figure out what's going to work best for them, as well as grandparents who may be taking care of their grandchildren. A lot of times they don't realize that we can actually help them get health care for their grandchildren based off of that scenario as well.
See, I'm learning something now new for the first time too, and I've done a lot of these. Joanne, tell us about the different types of insurance plans you have.
Okay, in our product portfolio, we can cover you from newborn up through age 65. So we're talking about Univera My Health, which is a Medicaid managed care. We have Child Health Plus, which is for newborn up to age 19. And the beautiful thing about the Child Health Plus is things have changed. And the difference between the Medicaid managed care and the Child Health Plus, at one time you could not have health insurance for your newborn with the Child Health Plus because your income prohibited that. Things have changed that we can go back to the beginning of the month that the baby was born. And that's a big deal for parents who have the means to pay for a Child Health Plus. They don't have to go a month uninsured.
Right, right. So when they sign up, are they insured right away?
For children, newborns, you have 60 days from their date of birth and it will go back retroactively. But typically the timeline is an application is done by the 15th of the month to be enrolled on the 1st of the following month.
Okay. What is a qualified health plan?
So qualified health plans are basically what we call our metal level plans. So they go everywhere from our platinum, which is going to be the plan that may cost a little bit more as far as premium wise, but there's going to be a much larger benefit package. Right. And then we have our basic plan, so that's going to be for ideally those young folks who, really they just need preventative care, and as long as what people need to realize is as long as you take care of that preventative care, that's going to minimize the additional medical care you'll need in the long run. Metal levels will also, for most families, and Joanne can agree, they may qualify for some form of a subsidy that will help pay towards those premiums, and then individuals have the option to either take that discount from those grants or whatnot that they would get through the government towards their premium, or they can use it as a tax write-off at the end of the year.
If people are going to come to you and they're going to sit down and they're going to make this decision, Joanne, what should they bring with them?
Basically, what they need is the knowledge of their social security number for everyone who's on their income tax return and their income information, a photo identification, as well as an email address. However, if your income has changed, meaning you've changed jobs mid-year, and New York State of Health is referring to the IRS or New York State Taxation and Finance, and your numbers don't line up, you may be required to bring in some additional documentation. So initially, say if you came to see me and I just said, Linda, come on in, bring your photo ID and let me have your email address. And we sit down, and then all of a sudden you change, and then you are an entrepreneur and you left the station. Right. And from last year, they know your income was here. they said, aha, we need to inquire about her income. And that would give us 10 additional business days to collect that data, have it reviewed so that we can get your insurance. So the short story is you need to know your social security number and your current income information and have a photo ID.
And I just want to let people know they work with people all the time who have the same basic questions that you and I have, and they are in the know and they are prepared to help you. So listen, when you go ahead and you call the toll-free number and say, I'm going to need an appointment, they'll tell you all this on the phone. And that way you can come in prepared. But you can also go to their website, which we had up the entire time, the univeradifference.com/U65. So either call or go ahead and log on and let these folks help you take care of yourself. Nobody does it like Univera Healthcare.
All right.